SCOAP hospitals have been working to avoid misdiagnosis in patients with appendicitis. The main focus has been on avoiding a negative appendectomy, an appendectomy when there was no evidence of appendicitis. Historically, there's been thought to be a trade-off between avoiding negative appendectomy and having a higher rate of perforation. It goes like this. If you operated on everybody very early, you would have few patients that had perforation, but you'd have a high rate of negative appendectomy. If you waited till it was absolutely certain that a patient had appendicitis and delayed your operation, you might have a lower rate of negative appendectomy, but a higher rate of perforation. Well, in SCOAP, we've been studying this for years. What we found is just the opposite, that there's no relationship between negative appendectomy and perforation. Perforation appears to be a pre-hospital event caused by delays prior to getting to the emergency room. And what we found is that hospitals that get more imaging, hospitals that have a lower rate of negative appendectomy, do not have a higher rate of perforation. Now, to work on rates of perforation requires a different approach, and one of the SCOAP metrics you'll find is how often a patient was in the emergency room within 1 week prior to their admission for an appendectomy. If you have a high rate of perforation at your hospital and a high rate of patients who've been at the hospital within that week but were sent home, that is an opportunity to educate the emergency room department and create strategies to decrease rates of misdiagnosis that have resulted in perforation.